There are some issues with synchronization that I think is important to keep in mind. First is that if you don't use the proper synchronization, you can have lack of trigger or delayed trigger, or if you have excessive sensitivity, you may have auto-cycling, where the ventilator will cycle at a much higher rate than what the baby is breathing. In that case, you will have insufficient expiratory time, and you may end up having gas trapping with over-distension. There is also a mechanism in all these ventilators to cycle off the inspiratory cycle. And this turning off, if it doesn't work properly, will end up with an excessive inspiratory time that produces essentially discomfort of the patient and fighting, or if it cycles off too early, will provide a very short inspiratory time, and that may compromise the tidal volume. So these are all things that you have to keep in mind and watch very carefully when you are using synchronized ventilation. Here you have a model where we induced a leak, and you can see then how the ventilator goes from a relatively low rate to a much higher rate of auto-cycling. And as I mentioned, this auto-cycling will induce a high rate, hyperventilation, hypocapnia, with negative results on brain perfusion, will increase mean airway pressure because you will have many more ventilatory breath, and will produce, as I mentioned before, inadvertent PEEP with depression of venous return and possibly decreased cardiac output. So very important to make sure that we avoid these complications really of synchronization. By far, the most common cause of auto-cycling is leaks around the endotracheal tube or water condensation in the ventilator circuit. So what can we conclude from synchronization? I think that there is no question that patient-triggered ventilation is much more comfortable for the patient and makes a lot of physiologic sense. That's how the patient will retain his normal respiratory control. It's associated with shorter duration of ventilation. It's associated in some studies with reduced BPD in babies under 1 kilo. It reduces the number of hypoxemic episodes, but we have to make sure that whenever we are using synchronization, we are doing it properly, because if the synchronization is not working properly, we can induce more harm than benefit.